So I see a wide range of clients. I would say I'm more of a general practitioner that sees everything from musculoskeletal to digestive to psycho-emotional to immune system. And some of those that I have an interest in are what I seem to gravitate the most in. So I have an interest in autoimmune and gastrointestinal diseases, gut health and psycho-emotional, spiritual kind of healing or awareness. And so I see a lot of those type of patients, and those are usually pretty chronically sick patients. And sometimes sick is a strong word, maybe chronically suffering. They've been to a lot of practitioners, they've looked for a lot of answers. And the reason that I mentioned this thing earlier about the functional medicine is a lot of times they come in with a binder of tests and they don't have any answers still, and they still feel not so well. So it's very common for this to happen, and they have a bag of supplements and they're like, I still feel bad. So these are the kind of patients that I work with. And for some reason, I have an ability to sort through this morass of stuff and zoom in on kind of the key issues. So when you do a lot of testing, then you have, oh, this problem, and you have this problem, and you have this problem, and you have this problem. And then, oh, well, here's a supplement for this problem, and here's a supplement for this problem, here's something for this, and then you have 10 supplements, here you go. And there's wisdom to that. That does help people sometimes. For me, it doesn't make a lot of sense because it lacks cohesiveness and it lacks the ability to see the underlying cause. Like, what is the underlying fundamental cause for all these branches? And I feel, and I have that ability somewhat to kind of zoom in on that. And sometimes it's very simple. Sometimes there's, multiple, legs or organ systems involved. But that's kind of what I try to do. And I'm often successful in helping these people who haven't had answers. And it kind of goes with my story of my health journey. I saw a lot of practitioners and I had to figure out some underlying causes in myself. So I have not only an awareness of the process, but personal experience of being there, suffering for years, and then finding a way through.